This is Pain Education, when pain becomes persistent, part of the Grande Prairie Primary Care Network Persistent Pain Program. Today, we will explore the question, what does pain mean to us? We'll define pain and talk about how pain can become persistent. We'll discuss the pain experience and meet pain specialist Lorimer Mosley. We'll talk about the things that can influence our perception of pain and changing our pain experience. Tame the beast. It's time to rethink persistent pain. Now, press pause and watch the companion video Tame the Beast, which can be found on our website or go to the address on the screen. Press play when you are ready to continue. What is pain? The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is subjective. This means that the self-reported amount of pain and description from the patient is our most reliable indicator of pain. Pain is an alarm or warning system. It is telling us that there is potential or actual harm being done to our bodies. At a very fundamental level, pain is all about your brain's assessment of safety. Unsafe things hurt. If your brain thinks you're safe, pain goes down. Pain is a protective mechanism. It comes from the brain 100% of the time. Pain is a brain output. It is meant to help us change what we are currently doing, to protect us. For example, if you sprain your ankle, you will begin to limp to avoid further damage. What other protective mechanisms do we have? Shivering, blinking, sneezing, and coughing are all examples of protective mechanisms. Types of pain. Acute pain is usually related to tissue changes. Things like bites, sprains, strains, and fractures can cause acute pain. Positional or postural pain can also be acute. Acute pain is generally self-limiting in that it will go away once the area heals or when you change your position or posture. Persistent pain typically persists long after normal tissue healing time and is not necessarily related to tissue changes. Persistent pain can occur without an injury or tissue damage. No one really knows why this happens. Pain itself often changes the way the central nervous system works, so that a person can actually become more sensitive and get more pain with less stimulation. This is called sensitization or amplified pain. This is why some people may experience pain from clothes brushing against their skin or wind blowing across their face. We mentioned how pain is a warning system. Sensitization is a condition of overreaction to threats to our body, a hyperactive warning system. Sensitized patients are not only more sensitive to things that should hurt, but also to ordinary touch and pressure as well. Their pain also echoes, meaning it fades more slowly than pain in other people. Sometimes, even thinking about a painful experience can cause one to feel pain. The process of pain. Peripheral nerves are sensors that send danger signals to the spinal cord. They respond to chemical, mechanical, and temperature changes. The spinal cord sends information to the brain and receives direction from the brain on what to do next. The brain is the boss. It decides whether to create pain based on past experiences, the current situation, and how important it is to pay attention at any given moment. Now, press pause and watch the video about pain specialist Lorimer Mosley as he talks about his own experience with pain. The video can be found at one of the 2 locations on the screen. Take as much time as you need. Press play on this video to continue. What influences our perception of pain? When we think and speak about pain, we all have different opinions. Our perception of pain is influenced by several factors, including our thoughts, our emotions, our mood, our previous experience with pain, what we believe about pain, what we've been told about pain, what others say about pain, and if we are already experiencing pain. Changing our pain experience. Changing our pain experience is often very difficult to do because how we react to pain can feel out of our control. Sometimes, one of the only things we can control is how we react to something. Our reactions most often start with our thoughts, yet changing our thoughts is one of the hardest things to do. By changing how we think, we can start to change our emotions, and then our mood. Hopefully, once we learn to do this, we can change our pain experience. The brain learns pain. Think back to the Tame the Beast video, where the dog was trained to salivate. In the same way, we know our brain has learned to feel pain. What the video didn't show was that after Pavlov trained the dog to salivate when he rang the bell, he then trained the dog not to salivate when he rang the bell. We now know we can teach our brains to unlearn persistent pain. Next steps. Pain Education 2. How to manage pain. In the next video, you will learn about the role self-management can play in changing your pain experience. You will also learn more about the Grande Prairie PCN Persistent Pain Program healthcare providers, and our group classes and workshops. Before you go, think about these questions, and if you wish, write them down and bring them to your case manager to discuss. What did you learn today? What stands out for you? Or what can you relate to? Do you have any unanswered questions? What do you want to know more about? Are you ready for the next step, learning about managing persistent pain? And finally, is there anything that is holding you back? This has been Pain Education, When Pain Becomes Persistent, part of the Grande Prairie Primary Care Network Persistent Pain Program.